this video, we're going to talk about diastasis or diastasis recti and what it is, how to check for it, because I want you to know how to feel for it on your own. That way when you're doing various exercises, you can kind of use your own skills that you'll learn to assess and make sure that the exercise is appropriate for you at whatever stage that you're at. So diastasis is a separation or thinning of the connective tissue, your linea alba. So the linea alba runs all the way from about your sternum down towards your pubic bone. And what it does is it kind of connects those two sides of the most superficial layer of abdominal muscles, your rectus abdominis. It connects those two sides. And so it runs along the midline. What happens naturally during pregnancy as the baby grows, belly gets bigger, that skin and the muscle has to stretch to accommodate the baby. So it's natural. It happens. The majority of women have some form of diastasis at the end of their third trimester, right before they deliver. Then what happens after pregnancy and delivery is, in some cases, women, it just goes kind of back to their normal within the first 8 weeks postpartum. But in many cases, it does not. And so we need to kind of progressively load this tissue in a manner that will strengthen it and kind of rehab and retrain your core. And a lot of times, you know, some of those traditional exercises you may think of for abs, like sit-ups or planks or V-sits, those may not be the best to start with. Not that they're bad exercises, but they just may not be the best to start with until you regain some more strength and stability in this region. So that tissue that runs along the midline, the linea alba, when it thins and it can separate a little bit, it might feel squishy. So that's kind of what we're looking for. We're looking for, does it feel firm, which is a good thing, versus does it feel squishy? And so when it feels a little bit squishy, meaning like your fingers sink in a little bit, that kind of gives us a sign that something in your deep core is not firing like it should, or maybe it's not coordinating. So like your diaphragm, your pelvic floor, your deep abdominals, something may not be doing its part, or maybe they all need a little bit of work. So that's what we're going to be looking for when we do the assessment. So it's important to heal your diastasis and to rehab and strengthen your core in a progressive manner so that you can get back to doing all sorts of exercises, but also because this connection helps transfer load in your body. So reaching, you know, into a cabinet or reaching to pick up your toddler or the car seat, all of those things, that load transfers through this area. And if it's weak and thinned, then that could contribute to symptoms like leaking or pelvic floor issues or back pain. So this is definitely something we want to look at and take care of, but it by no means means that you are broken or you are, you know, just that it's never going to get better. It does not mean that at all. I want you to know that this is common, but there are things we can do to retrain and rehab your core that can help heal diastasis. So there are ways to do that without surgery, and that's what my hope is for this program and for you to learn today to assess your diastasis so that you can help yourself as you go through different exercises.